Hello and good evening, everyone. I am Dr. Komal Lalwani, and on behalf of Nationwide Quality of Care Network, I would like to welcome you all on today's Community of Practice session. Today's session is on counseling support to mothers to practice optimal breastfeeding. So now I would like to call upon Professor Vikram Datta and request him to please invite today's speaker, Dr. JP Dadhich. So, Dr. Vikram Datta is the Director Professor at Department of Neonatology, ABVIMS, and Dr. RMN Hospital, New Delhi. He is the President of Nationwide Quality of Care Network and former Vice President of National Oncology Forum, India. He is the guest editor for BMJ Open Quality South Asia Edition. He is the member of editorial board for International Journal for Quality in Healthcare Communication and expert at the International Society for Quality in Healthcare. He is the lead for National Mentoring Group and Technical Resource Group lead for Sustainable Model for Lakshya by Ministry of Health and Family Welfare, India. He is also a member of QED, that is Quality, Equity and Dignity Working Group by Ministry of Health and Family Welfare, India. Over to you, sir.
Thank you so much, Dr. Komal. A very warm welcome to Dr. JP Dadhich, our senior and colleague from the National Neonatology Forum, a great proponent of prevention of malnutrition in India, improving the breastfeeding practices, and former secretary of the National Neonatology Forum of India. Sir currently is the director at the Department of Pediatrics and Neonatology at Rukmini Birla Hospital at Jaipur in Rajasthan. And like I mentioned, he's not only been the past secretary of the National Neonatology Forum, but also recipient of the fellowship of the National Neonatology Forum of India for his outstanding contribution to the field of neonatology. He has been the co-chair of the Global Council of International Baby Food Action Network from 2016 to 2021. He has over 40 publications and has contributed several reports related to child nutrition, infant and young child feeding practices to the aid of various governmental agencies, professional organizations, and UN agencies. And he has been the chairperson of the NNF Breastfeeding and Breastfeeding Support Promotion and Protection Committee, and the trainer and international trainer for courses on IYCF, on the International Code and Neonatal Resuscitation. Besides this, I would just like to mention that he's been a great proponent of encouraging mothers to exclusively breastfeed and improve the nutrition and the micronutrient deficiency disorders and the practices related to that. And we've had the good fortune of learning from Dr. Dadhich and all these years, and he's very kindly accepted our invitation to be on this Communities of Practice webinar. And sir, I would just like to mention here that we have mainly focused on getting our nursing colleagues on this webinar and our young students who have registered for this. Apart from that, sir, we are having a very active participation from our neighboring country, Maldives. As you can see, multiple participants are there from Maldives, and they have always been right through in NQCN programs. And we are very happy to welcome all our team members from Maldives as well. So over to you, Dr. Dadhich. The floor is all yours, sir.
Thank you, Professor Datta, and the team of NQCN for giving me this opportunity to speak in this very important meeting today. In fact, the topic itself is a vast topic, and in a presentation of about 25 to 30 minutes, I will only touch upon the salient information about this particular topic. I will present you a gist. Let me share my screen first so that we can okay. Actually, we just okay. So can you see my slide here? Is it visible?
Yes, sir, it's visible, sir. Please go ahead.
Okay. So before I start, again, I would like to thank NQCN team, Dr. Professor Datta, for inviting me. The topic today is counseling support to mothers to practice optimal breastfeeding. When we say there are two things here, one is counseling support and other is optimal breastfeeding. So when we say optimal breastfeeding, it means, and this is a global, global definition of optimal breastfeeding. Initiating breastfeeding within an hour, then exclusive breastfeeding for 6 months, then continued breastfeeding for 2 years or beyond, along with starting complementary feeding at 6 months of age. So this is the complete definition of optimal breastfeeding. So whenever we speak about breastfeeding, the meaning is that we are talking about early initiation, exclusive breastfeeding, and continued breastfeeding along with complementary feeding. The second term in the title is counseling support. So what is counseling support actually? So in this particular discussion today, we will talk about, what is counseling support, and I will just explain the term in today's presentation. So when we talk about counseling support, the first question which comes to our mind is why breastfeeding counseling is important. We all know about the benefits of breastfeeding, benefits to the health of the baby, the benefits to the health of the mother, then benefits to the development of the baby, benefits to the climate, economic benefits. All these things are, well established now. A lot of research is there, a lot of evidence is available. And there is no doubt, to accept that the early initiation is important, the exclusive breastfeeding is important, the continued breastfeeding is important, the complementary feeding is important when we talk about child's health, mother's health, the child's development, and all these things. So there is a consensus about practicing the optimal breastfeeding. There are, and I'm talking about our country, India, there are various policies, guidelines, and then public health programs, initiatives, which are all initiatives of Government of India on infant and child feeding and mother and child health. They all include optimal breastfeeding, like the IMS Act, the National Guidelines on Infant and Young Child Feeding, the National Guidelines on Lactation Management Centers in Public Health Facilities, the Guidelines for Enhancing Optimal Infant and Young Child Feeding Practices. This is for the institutions, hospitals. Then there are programs like this program, Mother's Absolute Affection MA program, which is a program for promotion of breastfeeding. And this is running successfully in our country for the last 6-7 years. Then the Lakshya program, again, it emphasizes on early initiation of breastfeeding, though it's the program about quality improvement in the labor rooms, but it also includes an indicator on early initiation. So all these things are there. And recently I came to know that in HMIS, now the one indicator has been included, and that is the percentage of babies who are discharged on exclusive breastfeeding in hospitals. So initiatives are there, and the intention of Government of India is very clear that the breastfeeding and complementary feeding should be properly addressed. But look at India's data. In spite of having so many policies, guidelines, programs, our data is not to the mark. You can see here, after NFHS 3 and 2005-6, the institutional deliveries have increased exponentially. It was on the institutional deliveries were only 38.7% here in NFHS 3. In NFHS 5, the National Family Health Survey 5, it's 88.6. So it's a huge increase in institutional deliveries. But here you see the initiation of breastfeeding, which was 23.4% in NFHS 3, has increased only to 41.8. And the more worrisome thing is that between NFHS 4 and NFHS 5, 15-16 and 19-21, in 5 years period, there is hardly any increase. Though institutional deliveries have increased from 78.9 to 88.6. So why this is happening? Because all these babies are being born in hospitals, all kind of facilities. Why the breastfeeding is not being initiated in the recommended time? Again, when we look into exclusive breastfeeding, and here you can see in below 2 months babies, it's 75.7%, but it rapidly falls. By the time the baby reaches to 6 months, it's 48.9. It consistently falls by the time the baby reaches to 6 months. And this is the period when you can see this is the complementary food, the red line, the green line is other milks. They are introduced in baby's diet, apart from the breastfeeding. And this is the period when mother needs support. Mother is being bombarded by all kinds of negative experiences here. I mean, there are people who are saying that your milk is not adequate, the baby is remaining hungry, your milk, you need to supplement something, and all kind of things are happening here. And this is the period when mother needs support so that she can practice exclusive breastfeeding. Then another worrisome thing. This is about the bottle feeding. You can see here, and these are NFHS 3, 4, and 5. You can see below 6 months, the rates are almost consistent. I mean, around 12%, 12.5, 12, 12.2%. But after, in the second year of life, the bottle feeding has increased. It has become almost double. I mean, in NFHS 3, it was 13.6%. In NFHS 5, it is 26%. So there is this new trend, and maybe here the commercial influence of formula companies may be a factor. But still, these mothers also need some support, telling them about the risks of giving the so-called follow formula and not giving other, semi-solid and homemade food, and practicing bottle feeding. So this is again another point, another thing which is really worrisome. So after going through all these data and the other information, the question is that in spite of robust scientific evidence in favor of breastfeeding, in spite of almost all the deliveries happening in the hospitals, in spite of robust policies, guidelines, and programs to protect, promote, and support breastfeeding, why breastfeeding practices are suboptimal? So it's a big question. We all need to answer this question. And there was a study which was conducted in 2018-19 in the hospitals of Uttar Pradesh. It was a World Bank project. It was a mixed format study, quantitative as well as qualitative. And the baby-friendly hospital initiative implementation was looked into in these hospitals. It was a multi-country study, in fact, Nepal, India, and Bangladesh. And this is the data about. So in the hospitals of India, that was in the hospitals of Uttar Pradesh, it was found, and there were hospitals, both government and non-government hospitals. It was found that there was inadequate counseling and support to mothers during antenatal and postnatal period. And there were various reasons which came out in this study. Lack of dedicated lactation counseling. Because in hospital, doctors and nurses, they are very busy, particularly in government hospitals. They don't have any time to talk to mother about breastfeeding. They are just prescribing breastfeeding. They are just saying that breastfeed. If mother is having any doubt, any question, any problem, then they don't have time to explain those things or answer those questions to help the mother. Then there was lack of required competence in health staff for lactation counseling. That is another point. I mean, when we say health staff, both doctors and nurses, they may not be trained in lactation counseling. So they are finding it very easy to prescribe. If mother is having some problem in not breastfeeding, then they are finding it easy to prescribe other things. Like this. They were prescribing infant formula in case a mother complained of not enough milk. And all and above, doctors and nurses, they believed that they were doing enough, that there is no need to do anything else. So when we look into all these things, probably they answer our questions why breastfeeding rates are not, because all these deliveries which are happening in the hospital, babies are finding the mother and babies, they are finding the same scenario more or less everywhere. Now we come to the second part. The first part was breastfeeding, optimal breastfeeding, and what is the scenario in our country. The second part is when we say counseling support, what is counseling support? Counseling support is not merely imparting knowledge to the women about breastfeeding, which is almost every time happens actually. We give all the information that this is good for your baby, this is good for you, this is good for your health, this is good for baby's development. But if mother is having any problem, then it is not sufficient. It is not a top-down intervention of telling women what to do. It's a two-way process. Counseling is a two-way process and an interaction between a counselor and a pregnant woman or lactating woman. So it's not a monologue. It's a kind of dialogue. It is a way of working with pregnant and lactating mothers to understand how they feel and help them to decide what to do. So a counselor helps a mother to take the best decision about herself and her baby, and then also helps the mother to implement that decision. So it empowers the women to implement good feeding practices and help them to overcome if there are any difficulties. There are various guidelines and recommendations for breastfeeding counseling. And this is a very important document which came in 2018. It was developed by World Health Organization, Counseling of Women to Improve Breastfeeding Practices. It dealt with various aspects of breastfeeding counseling, like to whom to give the breastfeeding counseling, when to give the breastfeeding counseling, who should give the breastfeeding counseling, then how the breastfeeding counseling should be given, and what should be the frequency. So we will take them one by one. Breastfeeding counseling to whom? The guidelines say that it should be provided to all pregnant women and mothers with young children. When? In both the antenatal period and postnatally, and up to 24 months or longer. Because we know that the breastfeeding should continue for 2 years or beyond. So if there is, and you have seen the scenario of increasing bottle feeding in our country. It means the mothers in second year also needs proper counseling. By whom? And this is very important. by appropriately trained healthcare professionals and community-based lay and peer breastfeeding counselors. Because the mother will remain in hospital for a limited period of time. After that, the mother will go to home and in community. And there also mother needs support in the form of counseling periodically so that she continues to practice exclusive breastfeeding for 6 months and then continued breastfeeding along with complementary feeding. How the breastfeeding counseling should be provided and the guidelines. And let me tell you that these guidelines, the WHO guidelines, they are evidence-based. They were developed using the GRADE method, and they are all the available systematic reviews, meta-analysis, and all the RCTs, everything was looked into, and after that, these guidelines were developed. So they are all evidence-based. So when they say the question answered how it should be given, so the guidelines they identified that so it should be face-to-face counseling. The face-to-face counseling may be complemented, but not replaced with telephonic counseling, because there are some reports which say that if it is not possible, the telephonic counseling is equally effective vis-a-vis face-to-face counseling. But these guidelines found that no, the face-to-face counseling is more effective. And if it is not possible, then telephonic counseling should be used, say particularly in emergencies, or they may be complementary to the face-to-face counseling. Here you can see in this photo, the mother, the counselor is using a flip chart and counseling the mother. Maybe it's an antenatal counseling. Then what should be the frequency of counseling? So the frequency, the guideline says that it should be at least 6 times, and additionally as needed. 6 times means before birth, that is antenatal period, during and immediately after birth, that is perinatal period, up to the first 2-3 days after birth, at 1 to 2 weeks after birth, neonatal period, in the first 3 to 4 months, early infancy, at 6 months at the start of complementary feeding, after 6 months, late infancy and early childhood. So these are the time period at which the counseling, the infant young child breastfeeding, infant young child feeding counseling could happen. There may be additional contexts, like as necessary, planning to return to work, or any time that concerns or challenges related to breastfeeding arise. If mother is having any concerns, say mother may start thinking that my milk is not enough, and at that particular point of time, that mother should be provided appropriate counseling. Then opportunities for breastfeeding counseling occurs, such as during child immunization. If mother is coming for immunization, again, this can be utilized to provide counseling to the mothers. Then there should be anticipatory breastfeeding counseling. We know that certain happenings or certain times they are difficult for the mothers, and the counselor should anticipate those things, and then anticipatory counseling should be provided, like returning to work, first-time mothers, multiple pregnancies. All these things are basically the difficult times, and mother should provide, the counselor should provide anticipatory. What should be the components? The counseling should be about the benefits, initiating breastfeeding, not giving pre-lactal feeds, benefits, dangers of artificial feed and bottle feeding, then demonstrations of correct positioning, attachment, expression of breast milk and cup feeding, and then very importantly, clarifying their mothers and families' myths and doubts. Postnatally, again, the same things, counseling about benefits, then skilled support, problems like engorgement, sore nipple, mastitis, if they are then the skilled support, then clarifying myths and doubts. So after, having information about what is counseling and how it should be given, by whom it should be given, when it should be given, what should be the frequency. Now let us see what are the skills required to provide effective breastfeeding counseling. And these are special skill sets. And they require actually, there are 4 special skill sets, and first of them is assessing breastfeeding using a breastfeeding observation form. So if your mother comes to the counselor should assess how breastfeeding is going on. The counselor should look into mother's general condition, baby's general condition, the condition of breasts, baby's position when breastfeeding, baby's attachment when suckling, and how the suckling is going. So all these things are a part of breastfeeding observation form. So assessment of breastfeeding is very important. Say, for example, if mother comes and says, my milk is not enough, then there should be a systematic way of looking into the breastfeeding, how it is going on. And the first part is assessing the breastfeeding. Then the second is listening and learning skills. So all these skills, the counselor should learn. And if a counselor is having all these skills, only then he or she will be able to effectively counsel the mother. So in the listening and learning skills, I am just touching upon the headlines here. I'm not going into details because it is not possible for going into details of these things here today. The listening and learning skills like helpful non-verbal communication, asking open questions while talking to the mother, then responding to show interest while talking to the mother, then reflecting back while talking to the mother, then empathizing and avoiding judging words. So all these things, all these skills are very important while talking to the mother. Then taking a history, like baby's feeding now, baby's health, behavior, the information about pregnancy, birth, early feeds, mother's condition and family planning, then previous infant feeding in the previous sibling, then family and social situations. All these are components of taking history. It's a long list. I have taken only the salient features here. So having a good breastfeeding history. So this is the third skill set which a counselor should acquire. Then the fourth is, after doing all these things, the crux comes here, building confidence and giving support. So in building confidence and support, there are, identified things are there, and the counselor should practice them. That accepting what mother says, praising what is right, then giving practical help, giving relevant information, using simple language, because a lot of scientific words are there when we talk about lactation and breastfeeding. So, say for example, there are hormones, prolactin and oxytocin and all those things. So the counselor should explain to the mother in simple words, not using the scientific vocabulary which may not be understood by the mother and family. Then making 1 or 2 suggestions. So this is how the building confidence, giving support is done by the counselor. So you must have seen that when we say that the counseling is not a top-down prescribing things, it's about understanding the situation of the mother by going into observing breastfeeding, then history taking and listening, learning, and then skills, and then building confidence and giving support. So this is a special set of skills which a counselor has. So it's not simply, not anybody can counsel a mother on breastfeeding. The person should be properly trained acquiring these skills. Is there any scientific evidence about breastfeeding counseling? Lot of research has been done on this. A lot of data is available. I have not included each and every study done in this presentation today. I have included only 2 studies. One is institution based. This was done with the Aligarh Muslim University. This was a kind of randomized trial in which there was an intervention group of 150, control group of 150. 2 nutritionists were appointed and trained as counseling and lactation counselors using BPNI's 4-in-1 7-day training program. Then mothers in the intervention groups, they received 2 antenatal and 8 postnatal counseling visits. And 2 research assistants, they collected data periodically. They were not knowing that, they were going to the mothers and collecting the data from both the groups. And here you can see the difference. This is the control and this is the intervention. You can see that in the intervention group, the skill counseling helped in sustaining exclusive breastfeeding. So these are exclusive breastfeeding data. It was on 3rd day, it was 98.6%. It dropped only to 88.1% at 6 months. So at 6 months, 88.1% mothers of the intervention group were still practicing exclusive breastfeeding. It was only 50% in the intervention group. So the counseling, the antenatal counseling and postnatal counseling actually helped the mother to sustain exclusive breastfeeding. Then this is a community-based study which was done in Lalitpur, Uttar Pradesh. And here village health groups were, mother support groups were formed in each village of the district. There were 3 persons in the mother support group, 1 Anganwadi worker, the Asha worker, and 1 elderly mother. They were trained in lactation counseling by the trainers and their mentors. The mentors were trained for 7 days using the BPNI training program. And these, the mother support groups, they provided counseling and skill support to the mothers at the village level. And you can see here the pre-intervention, post-intervention after 5 years data here. The initiation increased significantly. The use of pre-lactal feeds went down very significantly. Exclusive breastfeeding was 7% pre-intervention, became 60% after 5 years. The initiation of complementary feeding from 54% to 96%. So at community level also it worked, and it was an ongoing project, and it actually improved the habits, practices at the village level. And this was a kind of sustainable kind of intervention. So this was about the counseling support to the mother, which in the limited time available to us today, I could gather the information. So I would like to conclude today's presentation with 3 important points. The first is, for practicing optimal breastfeeding, mothers need counseling and not simple knowledge transfer or awareness generation. Second, policies and guidelines and evidence of what works for breastfeeding counseling are in place. Need is to implement them. I always remember Professor Datta's saying this in various meetings, that we all have guidelines. We need to implement them. So this is one area in which it applies very well. The third is, all the healthcare providers dealing with mothers and babies should learn the art and science of breastfeeding counseling through appropriate training. This is very, very important. I mean, in our hospitals, in our MBBS curriculum, in our postgrad, so there are few things now. MCI in the new curriculum has included some component of breastfeeding, but I think still a lot needs to be done in our medical schools, in our nursing schools, in our curriculum of frontline workers, and not providing only information, providing skills to counsel the mother. So that is the important message which I would like to give you today. Thank you very much.
Yeah, thank you, Dr. Dadhich.
Thank you so much, sir. I think it has been an excellent session very enlightening for all of us. And we have a large team of nursing professionals, including the former ADG in nursing as well. And we've got a set of DM students also from Dr. RML Hospital who have joined here, and lots of people from the neighboring countries, from Maldives, like I just mentioned, and in and around India. We are also pleased to welcome Dr. Syed Manazir Ali, who is one of the co-authors to the study. Welcome, sir. And I'll request sir to be please taken into the panel. And we have none other than the legendary Dr. Bana Purmat. Sir has been the president of the IAP IYCF chapter, overseeing most of the creation of these guidelines and leading the country to improve the infant and young child feeding practices. So, sir, before I take this forward, I welcome you to this session and take this opportunity for your expert comments and guidances and set the ball rolling. Over to you, Professor Bana Purmat, sir.
Thank you, Dr. Vikram. Before I speak, let's have some interaction. Manazir Ali is also here. I will reserve my comments at the end. So kindly invite, if there are any questions. We have a few from the chat box. Let's take them also. Manazir Ali first, please.
Yeah, so Dr. Manazir, please unmute yourself, sir. Komal.
So we have promoted him, but
Okay. It has been an excellent session. I really congratulate Dr. Dadhich. His very lucid presentation with excellent slides also. What I would like to say, he has brought out excellent scientific evidence to show that counseling is the essence of supporting a mother with breastfeeding. I would just give an example. For example, a person for the first time wants to ride a two-wheeler. The person goes through so much of anxiety. He feels lost. What should I do? How should I manage? Similarly, a mother who has become a mother for the first time also goes through the same situation. Sometimes she is born with two babies. Sometimes she is a very small baby, a tiny one who gets shifted to the NICU. Even when all things are well, we have to always keep thinking of what is going on in her mind. I find that is the most important point. Unless we get insight into her mind, we cannot empathize. So empathize means, I don't want to explain, but it's the most important noble thing for any person, whether it is breastfeeding or any other aspect of life. One should learn the high quality of empathizing with another person. Initially, what happens is when we are very fresh in this field, person always wants to give a lot of information. Very nicely, Dr. Dadhich said that pouring information should be the last thing. And the point which needs to be really emphasized very much is each of us have 2 ears and 1 mouth. This is an excellent point to remember. We have 2 ears, but only 1 mouth. Means if you want to talk for a minute to the mother, you should listen at least twice that time, minimum listening. And minimum talking, more listening. More listening should be the important point. And in counseling, observing is the most important thing. Don't interfere. Don't try to meddle with the breast, meddle with the baby. We always are very keen on, positioning should happen, this should happen. All that is for our learning. But with time and little experience, we realize that the less we interfere, the more we just pat the back of the mother. Counseling is already happening. We have to realize that counseling happens when the counselor very intently observes, empathizes, and listens. So these are very, very important points. And the last observation I would like to, highlight is What Dr. Dadhich again has said is about bottle feeding and its incidence in NFHS 5. My God, what a shock we got when we got these results. 26 to almost 30% of our children are exposed to a bottle in the first 2 years of life. In fact, instead of coming down, bottle feeding incidence has gone up. And the problem happens in NICUs much more than anywhere else. So all these things kept together, it's a big war that we have to keep on doing. Counseling, refining our counseling skills. But I'll tell you one positive thing. Whenever you help a mother who is struggling with breastfeeding, when you help her, the amount of satisfaction the counselor gets is immense. It cannot be compared with anything at all. Whenever we do a good counseling session, the amount of blessings that you get from the mother and the way she can overcome her difficulties, it's something really very, very satisfying to our mind, body, and soul. So counselors are blessed people. Counselors, again, I would like to conclude saying that they interfere less, support more. For example, at the end, I will say only one point. If a mother is feeding the baby, she is trying to hold the baby, whatever way she is holding, don't put in anything. Just observe. Kitne achhi kar rahe ho, tum bahut achhi kar rahe ho. You can do a little better. You can bring the baby, whatever you want to do is only after having praised her. So thank you for giving me an opportunity to share a few points. Vikram, it was an excellent session and congratulations. I'm really very impressed by the participants list. That is where really a session counts. And well done. Well done. Thank you very much.
Thank you so much, sir, for those inspiring words and insights into the importance of counseling. And I think no one else than me every single day when I take the postnatal rounds, sir. And I'm sure we have Dr. Sandeep, who's one of our DM residents here in Dr. RML Hospital. It is the counseling part which is most satisfying in the postnatal rounds, helping the mothers to initiate breastfeeding and continue, and the look and the expression of satisfaction, sir, even today morning, I think that was one of the best parts which we had in our rounds. And I think that is something which should happen, and everybody should play the role of the counselors. I request Sanjana Taneja, who's a student from Lady Harding Medical College, sir. She's being one of the founding members of Be the Change group, also a young professional group of NQCN. And I would like to share here that they are participating and they've been invited to be participating in the G20 young professionals part also. And yesterday we've just submitted their, proposal to the G20 Council. So I request Sanjana to please unmute herself and ask a question, though she's put it there. Sanjana, if you're there, you can please unmute yourself.
Good evening, sir. Thank you so much for the opportunity. So my question was just about the role of medical students in promoting ideal feeding practices, considering there is a significant number of young professionals who are posted in hospitals and community settings. If there is some role that we can play to alleviate the pressure or the burden on other healthcare providers to promote feeding practices, and whether family-based counseling would help young mothers in improving their breastfeeding practices as well in terms of support and skills. Thank you.
Dadhich, sir.
Yeah, sure. Thank you very much for the question. It's an excellent suggestion that medical students, they themselves, because they are posted in pediatric wards, they are posted in postnatal wards. They are going there, talking to the mother. And if they take this responsibility, because we are always short of hands there, short of minds there, short of people talking to the mother and helping mothers to successfully breastfeed. But before that, though there are certain things on breastfeeding and infant young child feeding in the new curriculum now, they should gather appropriate information, appropriate skills about breastfeeding, and if possible, the counseling skills also, because counseling skills require dedicated training for this. And when we say counseling skills, it's not that the counseling skills once acquired will only be used in breastfeeding counseling. Counseling skills can be used in any field actually. I mean, when you learn counseling skills, when you learn how to listen, I mean, how to speak, I mean, keeping your head, I mean, at same level, empathizing, reflecting back, all these are skills which are useful in your day-to-day life also. Your family, I mean, when you talk to your family members, even they will notice the change, that something has changed in you actually. So this is, I mean, and to acquire these skills and help the mothers, it's a very welcome suggestion, and I really appreciate that this has come from you. The second point which you said was about the family centered counseling. So when we say counseling, I have used the word mother and family. Mother and I mean, if there are family members, now we have more and more nuclear families. So if the mother and father, baby's father is there, and if we have more members, the mother-in-law or any other, I mean, the child's baby's aunt or somebody else, all those people should be, I mean, counseled together. I mean, because when we say that the mother should have a supportive environment at home, then all these people actually form the environment. So if and we know that how important it is to keep mothers' confidence high, and all these people they can contribute to keep mothers' confidence high. I mean, they should not say anything negative about, I mean, about breastfeeding and how feeding is going. They should give positive I mean, atmosphere to the mother. I mean, as Banapur just said, that when the mother comes to the counselor, if don't look into how mother is doing, you should say that, oh, you are doing good, you can do better. I mean, you need not to say that you are not doing not you are doing something wrong. So that kind of atmosphere should be available to the lactating mother at home. So all these people are very important, and they should all be counseled actually. Yes.
Thank you so much, sir. I think Sanjana has got the answer, and in fact, it is a great suggestion, I'm sure, for most of us involving our young medical professionals, and that is what I think the Be the Change group of NQCN is also doing, involving the medical and nursing professionals into quality improvement and implementation of guidelines, sir. Next question, very quickly, we have the last 5 minutes. I'd like to take quick questions now from Ankit Chel. Ankit, can you unmute yourself and ask your question, please?
Good evening, sir.
Yeah.
Sir, actually, my question is like, what else can we do in our part? Like, I'm a medical student. And so, like, what can we do to ensure that the mother follows this? Like, I get this thing that counseling is the most important part. But what if, like, they agree with us and then they just don't follow it?
I think Dr. Banapurmat, sir, you can take this.
Yeah, you know, it's a very, very valid point that you have raised, Ankit. Especially, you know, the medical student, they know they are all pretty young people, and the mother or her mother-in-law, they all say, "Hey, bachche, isko kya malum hai? Kya bolta hai?" No, this is a very common thing.
Yes, sir.
Isn't it? So, yes. See, what is the aim? You have to have should not come in the way. First of all, see, be very, very polite, humble, and even if she allows you to see what's happening, you know, for example, baby is born in the labor room. Dr. Vikram has been doing so much of work to, you know, bring in that we want skin to skin contact should happen as early as possible. Let's just talk of this one example. There are so many barriers in between the nurses of working who are there, Some of the nurses are pretty senior, 20 years, 30 years. They know much more than what a young medical graduate is about to learn. It's all like, life experience, it's given. The question is given first. Answers they come later. So coming back to addressing they don't accept what you say. You're not trying to gain their acceptance. The best thing that the medical student should do is, at least in one session, his senior, it may be obstetrician or a pediatrician or a lactation counselor or a senior nurse, just observe how they are helping this woman. You are a learner. Remember that. You are a beginner. You are a learner. Counseling is something that it is, as you rightly say, it's not only most important, it's the most vital thing. If you have to refine your counseling skills, it takes time. It takes years together, weeks together of continued exposure. Only then you fine tune your counseling. What I would suggest is, don't try to give suggestions. Just keep saying, oh, your child is so nice. Kitna acha hai tumhara bachcha. Bas. Just keep, praising the baby. What a lovely baby you have given birth to. She's looking so good. Already she feels so, she relates to you. No, aisa pakdo, waisa pakdo. No, don't try to do that. That is what I was telling. As we mature in our counseling skills, we learn that less interference, more observation, less talking, more listening. These are the things which will help you. That will help you for the next case. Again, it will get better with another more case. I hope I have made the point clear, but the question which you have raised is, yeah, it was a very, very valid one. It will go through in the minds of all our beginners. And this is beginning. It's a beginning. We have to keep learning. Our egos must never come in the problem, in the consideration. Okay.
Thank you so much, sir. I'm sure that answers Ankit's question, and I'm sure the example which you gave, we put 2 eyes, 2 ears, and 1 mouth. I think that is something which is excellent, sir. So less of talking, more of observing, and more of listening. I think that we will all remember.
And more of appreciating. More of appreciating.
More of appreciating. Yeah. So next, I know time is running out, but Dr. Dadhich, sir, if you allow me another 5-7 minutes, I'll take 2-3 questions very quickly, because this is very, very important for the country. We need, next time you present this data in NFHS 6, we want a quantum jump, sir, and the young population is here. So, and also the neighboring countries, it is very, very important. So I would be very happy if somebody from Maldives also puts up a question, and we would be very happy to hear the Maldivian experience. But till that time, I'll request Dr. Prabha, who's an obstetrician at Bhagwan Mahavir Hospital, another spectrum. From the other side, we know that obstetricians are very, very important components of a successful breastfeeding support group, I would say. So over to you, Prabha, for your questions and observations very quickly.
Thank you, sir. Good evening, all. Sir, my question is regarding EIBF. Sir, as you said that exclusive breastfeeding has come into our data in HMIS. Similarly, EIBF has also come into care around birth reporting, monthly reporting, and it has become a very important key indicator for quality of healthcare. And following Lakshya initiative and other quality initiative movement, most of the government hospitals are after achieving the target, in normal delivery cases and in cesarean section cases within 1 hour to initiate early initiation of breastfeeding. So in a normal delivery, it is not very difficult, and we have achieved that target in 2018. Also, more than 80% babies delivered by normal delivery are initiated EIBF successfully. But in case of cesarean section, we had to work hard, and very recently this target we also achieved by following some quality improvement techniques. But so my question is, how important is that 1 hour adherence for EIBF? In my MBBS days, it was clearly written that within 1 hour in normal vaginal delivery and within 4 hours in cesarean section delivery, considering the anesthesia effect and all those things. But for recently, it has come into thing that in cesarean section also we have to initiate EIBF within 1 hour. And next is next question is in counseling also, WHO recommendation counseling. Only one counseling is in antenatal counseling. Most of the counselings are postnatal. Then for EIBF, that means for EIBF men, we should counsel. And can we increase that time frame, 1 hour time period to little longer, especially in case of cesarean section deliveries? Thank you, sir.
So first part, I think Professor Banapurmat, and second part we'll have very quickly from Dadhich, sir. Banapurmat, sir, first part.
Yeah, excellent. I'm really very happy to be participating in this session. All these are practical problems. What I would say, EIBF, though it is said it is 1 hour, nobody wants to wait for 1 hour. More than initiation, what is much more important is getting the baby and the mother close to each other. I'll repeat, getting the baby and mother very close to each other to provide skin-to-skin contact. This is much more than initiating breastfeeding. Please remember, what we are aiming at, the baby and the mother should come very close to each other. You have heard about kangaroo mother care. You have heard of skin-to-skin contact. Provide that. Rest, the nature will take care. It's so well designed. If the baby and the mother come very close to, even if it is a cesarean section, there are hurdles and barriers, but when you work with your anesthetist group, you work with the labor room people, things can happen. What is important is get the baby and the mother close to each other. I would say don't increase the time, decrease the time. You are saying, why not make it more than 1 hour? I would say, make it less than 1 hour. Don't waste your time. For that, of course, there are hurdles, there are issues. A junior fellow can't be talking to unless he takes help from all the people. We have to work for that aim. That is what one point I would say. And next thing is, don't push the breast into the baby's mouth. We should never do that. Give skin-to-skin contact, leave it to nature. The baby may be wide awake, it'll automatically, we know all that. I don't want to explain more. Rather than early initiation of breastfeeding, aim at early contact, skin-to-skin contact between baby and mother. You would be doing much better than any, variable or target approach. You will be doing so much good for the baby and the mother. Dr. Dadhich.
Yeah, sir, why only one counseling is been designed by WHO recommended, whereas EIBF is something which the mother is going to do immediately at birth, and only the contact is one. I think that's a very intelligent question to her. And Dr. Dadhich, over to you, sir.
Yeah, I agree. I mean, as I told you during the presentation, that these guidelines were based on the available information, available research. And they found whatever information, whatever published data, whatever RCTs and observational studies they found. So these guidelines are based on those research papers actually. But I agree. If there are more opportunities, because we said that there should be at least 4 antenatal visits. It may not be prudent to talk about breastfeeding in the first antenatal visit, but second trimester onwards, if mother is coming for antenatal visit, then of course we can talk about breastfeeding. It doesn't take much time, and if it is possible, then we can increase. We can include breastfeeding in all the antenatal visits for which mother is coming there. And the question about the 1 hour breast, why it was kept 1 hour, it's based on science actually. There was a study published in 2006, the Edmond study, which basically it was a side data which they analyzed. It was about vitamin A supplementation, and it was the 10,000. It was from Ghana in Africa, and they found that if the initiation of breastfeeding is delayed, then neonatal mortality increases, and so much so that if breastfeeding is started within 1 hour, and if it is delayed for 3 days, there was a 6-fold increase in neonatal mortality. So it's all very robust scientific data which is there in favor of initiating early breastfeeding. So, these are the points which I wanted to share. I hope I have answered the question.
Professor Banapurmat sir wants to
Could I
add
make
something.
a very quick point,
Yeah, sir,
Dr.
definitely.
Dadhich? Yeah, wonderful. Whatever the question which has been raised is so very good. But please realize that when the baby is born, it is alert for about 20 to 30 minutes. All its reflexes are very sharp and very nice. After half an hour, 40 minutes, the baby will go to deep sleep. If you lose those 20, 30 minutes after childbirth, you are missing a bus. You are missing the bus. So realize that, again, I come back to the point, skin to skin contact, do it so, and then everything happens by nature. You're helping nature to happen. So the baby is alert for 40 minutes, 20 to 40 minutes. That is the key point you should remember. Okay.
Another
think-
point, when we talk about particularly about early initiation of breastfeeding, I am of firm belief that the quality improvement initiatives are very, very helpful here, because you
No
go
doubt.
to an institute and then look into everything and then come out with some improvement ideas. And there are a lot of studies which have been published in which they were able to improve their early initiation using the quality improvement initiative. So this is one area in which the work of NQSAN is very, very important.
No
Thank
doubt.
you so much, sir. Thank you so much, sir. I think that's a phenomenal discussion going on. I hate to interrupt, but two very quick questions, and then I think we can, for people who have more questions, can continue to post them to NQCN office, and we will get back with both the experts who are very eminent. So the next two questions, sir, we have a question, one which is from one of our nursing colleagues, and it says, Shobha Rajiv, she says that if the baby has more than 12% weight loss on second and third day of life, that's a very common thing, sir. Even I'm facing quite similar scenario in my postnatal rounds. What recommendation should the nurses do, sir? So because most of the time the mothers are very terrified once we have this weight loss pattern 13%, and then in this weather now we are also getting babies who have pyrexia, and even hyperbilirubinemia is increasing, and they shift them out of the postnatal ward into the NICU for phototherapy, and that leads to separation, disruption of the lactation. And this is a great challenge, sir. So both of you, I'd like to have quick comments, sir. As a guidance, what should we do in such situation when the weight loss is excessive on day 2 and 3?
Can I?
Yeah, definitely, sir. Please.
Okay. Now, this is what we call as summer babies. The ambient temperatures are very high. And if the baby is in a postnatal ward, there's a lot of sunlight and all that. And the situation will become worsen if the baby has other comorbidities like born very small, it needs phototherapy. But here again, I'm very happy our nurse has raised this question. What we nurses must do if it is 12% weight loss? Okay, to answer your very, very valid observation and question, what I suggest is, please look back to look forward. What do I mean by that? Look back to look forward. There was one great professor, Forfar Arnell. He was always saying this and emphasizing, look back to look forward. What has happened from the time the baby has born, and by the time you notice the 11% or 12% weight loss, we have lost a lot of opportunities. Those babies where early skin-to-skin contact, EIBF was initiated, they would never go for this unfortunate situation. That is what is to be looking backwards. Okay, that is one aspect. Already the baby has lost 12% weight loss. First and foremost, I would suggest you share this privately with your consultant. Don't tell it to the mother. That is my first thing. Don't make her more conscious and worried. Then you will lose the battle. Of course, you have to share information, but there is a way of sharing. Your child has 12% weight loss. There is a very horrible way to tell to a mother. And if you get anxious, it gets transmitted to her. Okay, your observation is valid. Share it privately with your consultant or your seniors or your team. My first thing. Second thing is, in this baby, try to see that, how you are going to rehydrate the baby. It's the dehydration which results into weight loss. The rehydration is left to your consultant. He may choose an IV fluid, or he may choose some, express human milk bank if it is there, milk bank supplement. Leave it to him. As far as the nurse is concerned, don't get worried and terrified. Don't transmit that to the mother. That is my observation. So how it is dealt further? Yeah, there are people, there are neonatologists who will find out what was the intake of milk. Most often it is low milk transfer, LMT. This low milk transfer is such a topic. Again, Vikram has to keep a couple of sessions for that. It's a huge topic. Anyway, to summarize everything into short way, whatever you communicate to your mothers, it should be done in a very, very unfrightening way of approach. But you can always fall back onto your seniors. What we are going to do, sir? How we are going to manage this problem? And don't talk in her presence. That is what I would suggest. Okay.
Yeah. And yeah, you have rightly, explained everything, sir. I just want to add that in all these postnatal wards, it will be a good idea to use age-specific weight loss charts. Actually, they are available now, and they are, they are different for normally vaginally delivered babies and for LSCS babies. In LSCS babies, somewhat more weight loss is allowed actually, because they receive hypotonic mothers. They receive hypotonic solutions before delivery and after during the delivery, and that fluid which comes to babies actually excreted, and that also adds to the weight loss. So those and the less than 90 percentile, if the weight loss goes beyond that, then probably it is a kind of concern and requires all kind of interventions, as Professor Banapuman just suggests. So those they are very handy. We use those charts in our unit.
Okay.
Thank you so much, sir. I think that was great, solutions to the very common problem, which is going to come up in most of the setups across India, we being a tropical country. Just to end, we would like to have quick comments from Ms. Susie Sarah John, who's a senior tutor and at the Lady Hardinge College of Nursing, and followed by the concluding comments from Professor Sushil Srivastava, Professor of Pediatrics and Neonatology at GTB Hospital. Sushil, you can also start your camera if possible, and Susie ma'am, you can please go ahead with your, and she is in charge of the teaching and training of the BSc nursing students and also governing board member with NQCN. Over to you, ma'am.
Thank you, sir. Good evening, everybody. It was a very lucid presentation, of course, but I was alerted to the data that came up, what happens to babies after 6 months. Particularly, the breastfeeding rates are going low. Not just the data, I have come across my own relatives and my friends whose children give birth and they slowly switch on to the bottle after 6 months. So another comment that I would want to say over here is, we have to do something at the community level so that the breastfeeding rates keep going ahead even up to 2 years. Those are my comments. Definitely the nursing students are also involved in the counseling, and we must look at how we can involve them more in the counseling for normal normal birth babies as well as the C-section. Thank you, sir.
Thank you so much, ma'am. I think we will now move to, I hate to close this, like I said, it has been such an engrossing discussion, Dr. Dadhich and Dr. Banapurmat, sir. And over to you, Sushil. You are also in charge of the inborn and the outborn neonatal ICU at GTB Hospital and University College of Medical Sciences. Your observations, you also published your paper in the BMJ on care around the birth practices for 3 years data from UCMS. So could you just give your concluding comments and then close the session, please?
Right. Thanks, Vikram. And it's a wonderful session. I'm really thankful to Dr. Banapurmat, Dr. Dadhich for again making some very, very important points. And I'm really thankful to all the participants today. They matter most. And yes, each breastfeeding is a joy. We must ensure treating neonates, salvaging neonates from an ICU, handing them to the baby, to the mothers is one part. But the biggest part is ensuring exclusive breastfeeding till 6 months without top feeding. And I think the message has gone crystal clear to all. It's a constant battle, as Dr. Banapurmat said. Yes, there are so many fluctuations, so many pressures to watch for the mother. And with today's era of media and you can say a lot of awareness, I echo the thoughts with Sister Susie Sarajon that we as doctors and nurses have a lot of responsibility to disseminate this celebration of breastfeeding within 1 hour, in fact, within half an hour to the community. I think if community, students, nurses, ASHA, A&M take this important aspect of treatment, it's a treatment. There's no doubt about it. It's an actual intervention. I think we'll all be much better off. Thank you very much. A very engrossing session, and I will request Vikram maybe to have a few more sessions. I think they'll lead a lot of benefits like feeding and especially care of the normal newborn. They are very, very useful for all our masses. And thanks to the participants from overseas who have joined and have been there throughout the session. Thank you very much and have a good evening.
I'll just take over from here, Sushil. Two very announcements from here. Thank you so much for your comments, both Susie ma'am and Sushil. I would just like to mention here that NQCN has partnered with IAP IYCF chapter to develop and contribute to the national breastfeeding guidelines. The quality improvement component has been entrusted to the core group, sir. You saw most of the people who are forming the NQCN fraternity here. These are the people who are trying to implement, and something which probably the policymakers feel. The other day we were somewhere, and I would mention it previously, and somebody just said that breastfeeding is something which is very simple. You guys need to concentrate on something else. And sir, look at the data and look at what is the benefit of initiating breastfeeding and how much quality improvement interventions can help in implementing these guidelines. So I think we will have more of such sessions, and maybe plan, if both of you agree, sir, Banapurmat sir and Dadhich sir, and our nursing fraternity also here, we can have a 1-day short 4-5 hours for the entire Southeast Asia teams on the communities of practice, maybe at a later date. That is what I am proposing from our side. And we can work that out together, and we'll look forward to participation from other countries as well, especially Indonesia, Maldives, Sri Lanka, Bhutan. These are the countries which actively participate in our communities of practice. So I'll call upon Komal to make a very quick 1-minute announcement regarding the annual conference, and we will just end after that.
Thank you so much, sir. So we're very happy to announce that we are organizing our second annual conference 2023. So this is going to be happen on 4th and 5th November in Bengaluru, India. So this is the second annual conference on healthcare quality and patient safety. So these are the teams for organizing the conference. The international speakers who are coming up for the conference are Dr. Paul Vitalden, Dr. Carsten Angel, Dr. Peter Lackman, Dr. Neelam Dhingra, Dr. Daljit Koti, Dr. Kathleen Semrau, Mr. Seema Osman, and Dr. Poonam Gupta. Whereas on 4th November, we have the pre-conference workshops. So there are 8 themes which on these the pre-conference workshops are available. We'll share the brochure with you, and so you can look at it and register for one of the workshops. So this is the agenda for day 2. So the registrations are on. It's there on our website, so you can just register. So the early bird registration is allowed till 31st of August. So you can register at an early bird rate. And the registrations are separate for NQCN members and non-NQCN members. And if you want to become the NQCN member, you can just scan this QR code or you can just click on the link. So you can just take a screenshot of this page and then register as for the conference as well as for the membership.
Thank you so much, Dr. Komal. I think we take this opportunity to invite you all to Bengaluru and be a part of this international gathering. We have the co-founder of IHI, Dr. Paul Betalton, and the SQA CEO who would all be there. And we look forward to welcoming all of you in there and also showcasing innovations in quality of care. So, and some very excellent workshops like Komal mentioned. We look forward to subsequent interactive sessions. And like I mentioned, we will be planning a short workshop session for upskilling our people into IYCF practices and also breastfeeding initiation, early initiation, and also continuation of good, diversification of diet and also micronutrient related activities, which IYCF chapter is taking forward. So I know this has been a longest session, but thank you so much, Banapurmat sir, for coming and gracing the occasion. Dadhich sir for an excellent presentation. The entire governing board of NQCN, which is there, including the office bearers, teams from the neighboring nations who are there, my frontline healthcare workers. We have Usha Rani ma'am also, like all times she has been around. And Geeta Rani ma'am, she has been around. Thank you so much. Our frontline teams from Madhya Pradesh, various other district and sub-district hospitals, and medical students and nursing students. So I think, and obstetric colleagues. So the spectrum, Dadhich sir, has been complete. And thank you so much. Everybody have a safe weekend ahead. Good night and see you all in the next session subsequently. Thank you and good night.
Thank you very much. Thank you.